So hi, everyone. Welcome. My name is Jami. I work as a professional academic advisor here at SSU in the Advising and Transfer Center, and I advise pre-nursing students. And so I often get asked about nursing from students that aren't in the pre-nursing program, who are in another major or maybe undeclared, and they want to get into nursing and maybe aren't really sure how. So of course I provide one-on-one advising for those folks, but I like to do this workshop this time of year in particular, because I think it helps those students start to think through what they would need in order to apply to nursing, whether that's at SSU or another nursing school. So that's kind of what we're going to cover today. So a little bit of our roadmap. I want to talk to you a little bit more about my role and how you can utilize me as an advisor on campus. I'm going to talk a little bit about the pathways to nursing, because there's actually more than one. Students are often familiar with what pre-nursing students go through on this campus if they're admitted into that program, but there are actually lots of different ways to get to be a nurse. So we'll cover those. We will talk about the required courses needed here at SSU so that you know what it would take to get into the program here. I'll go over the application process and how we assign points so that, again, you're understanding how you can be competitive to get into Sonoma State's process. I'll give you some tips on how to strengthen your application. And at the end, we'll have definitely time for questions, although you're welcome to ask questions throughout the presentation. That's completely fine. But I've prepared a few FAQs that I get commonly asked, so we'll go over those today. So that's going to be our time together. So I'd like to start out, I'm actually going to do a poll with you. So this is going to be anonymous, but I'd like for you to kind of check in with yourself about how you're feeling about nursing. And so I'm going to launch this poll. So if you could share 1 to 2 words about how you're feeling with regards to nursing. So I'm going to leave this open just for maybe 20, 30 seconds. If you can share, again, just how you're feeling in this moment. There's no right or wrong answer. Just want to kind of get a sense. So if you're not near your computer, it has popped up on your screen. So if you get a chance to go ahead and answer, that would be great. Looks like there's only 2 of you that have responded, so I'll give it another maybe 15, 20 seconds. Last call to chime in. All right. So I want to go ahead and share the results. Are you all able to see this page right here, the web page? I guess I can't really see anybody's faces, so either give me a thumbs up. Yes, great. Okay, wonderful. So just some responses from folks. Some folks are talking about, I would love to become a nurse and help people. Someone's on the fence. That's really fair. Someone's feeling really confident, excited and overwhelmed, interested and curious, worried and unsure. Well, that's definitely a range, but that's actually completely honest and it's not uncommon. I hear students sharing that a lot. Even students that are in the pre-nursing program can feel a little overwhelmed or confused. Nursing is a competitive process. And so to come to this stage and feel a little bit overwhelmed, completely normal, but let's see where we can get you before we're done with our presentation today. All right, let's head back to our. Okay, so a little bit more about me. I actually work as the pre-nursing advisor. So students admitted to SSU under pre-nursing will work with me directly. And then I advise really any student that wants to pursue nursing, even if you're in another major, you're not already assigned to me as an advisor. My other caseload is that I work with lower division science and technology majors. So I may interact with some of you if you're in one of those majors already. One of my main goals is really to assist you in staying on track to apply to whether it's the SSU program for nursing or any other nursing program that you want. Nursing schools are competitive, and if you were looking at medical school or pharmacy or veterinarian, you would likely apply to more than one school. And so that's the case for SSU students. So we want to help set you up to be able to not only apply here, but to other schools that are on your list. Another goal is to aid you in knowing all the pathways to nursing, because while you might be on one initially, those pathways can change. And so it's helpful to know all of the different options so that you can pick the one that works best for you. My other big goal is to help students getting their lower division general ed courses completed. There are required courses needed to get into nursing, but you also have to finish your lower division GEs. So that's a big part of what I do too. And then, like most advisors on campus, we're really here to help you be successful, help you navigate the university, and connect you with resources. So a little bit of an overview of how nursing works here at SSU. We admit around 50 pre-nursing students each year, but they can only be first-year students. We do not allow students to switch into the pre-nursing program or transfer into it, but that's kind of the number. It's about 50 students each year. Those students complete 2 years of prerequisite work, including their lower division GEs, and then they're eligible to apply to what's called the pre-licensure program, which is sort of 2 more years. So that's how you get a total of 4 years to reach the BSN. The pre-licensure program, that application cycle happens once a year, and we only admit 24 students. And each year we get around 400 applications for those spots. So that's an overwhelming number, and I don't share it to scare you, but I do share it because I think it's helpful to understand how competitive nursing is. Now, this year we haven't released who has gotten into the program for next fall. The application just closed in January. We received a little bit under the 400 this year, so it's remains to be seen if the pool was less competitive in previous years or not. And then, like I said, students who complete those 4 years will receive a BSN, Bachelor of Science in Nursing, and they're eligible to sit for the RN licensure exam. So I do like to share, though, that there are other pathways to get to nursing besides the one that I just described. So this visual, I think, is really helpful for some students. So on the right-hand side, you kind of, again, see you've got about 50 students coming into SSU in the pre-nursing pathway there on the right. They take about 2 years, they get their prereqs, then they can apply for the BSN. If they get in 2 more years, then they graduate from SSU. But on the left-hand side, you can see that we have students who are in other majors who do the exact same path. They just aren't officially in pre-nursing. So they take the prerequisites, they work on lower division GEs, and then they too are eligible to apply for the BSN. If they get in 2 more years and they're done. But you can see that there's sort of a longer arc on the kind of the forming a circle on this particular pathway. Some students, if they decide to delay applying to nursing school, or maybe they apply and don't get in, they may start to look at finishing a degree in something else first, and then look to applying to nursing. Because if you already have a bachelor's degree, you actually have additional options available to you. So you can apply to the traditional BSNs like ours, which are 2 years. But if you already have a bachelor's degree and the right prerequisites, you can also apply to what's called an accelerated BSN. So you'll see that listed as an A-BSN. The accelerated programs are 12 to 15 months as opposed to 2 years. So if you've already spent 4 years on a bachelor's degree, there are programs that are basically 1 more year, and then you would have 2 degrees. You're also eligible for direct entry master's programs in nursing if you already have a bachelor's degree. Now, those are longer. Those are typically 3 years. You got to get caught up on clinical experience, et cetera. But for some students who know they want to be a nurse practitioner, looking kind of ahead at master's programs right away can be a benefit. So I share this because not that you can't have kind of the shortest pathway in mind, but sometimes it's helpful to know that along the road, if you need to change it, it doesn't necessarily mean that you're sort of just constantly looking back and chasing that original goal. There are some additional benefits to changing it up. I'll explain a little bit more about why students would do that. I also share on this particular diagram that there is a pathway to becoming a nurse through the junior college or the community college route. Students can become a registered nurse through a BSN program like Sonoma State's, but also through associate degree programs, ADNs. The difference that we're seeing is that more and more, I mean, while there is a nursing shortage, there is a big push towards hiring nurses who have bachelor's degrees or who are bachelor's educated. So certainly there's more money to make with BSNs, greater opportunity for moving up, becoming management, et cetera. But it is a legitimate pathway. And we even have students, even though if you were in any other major, if you were at a 4-year institution, you wouldn't necessarily go back and look at a 2-year degree. But when it comes to nursing, and because of how competitive it is, it's absolutely an option that some of our students will look at. And there, again, there's many reasons for that. JCs typically are a little less competitive. They don't often base it on points. So down here on the left, it shows that we have 24 spots and it's based on points. Whereas SRJC Santa Rosa has 120 and it's based on a lottery. So you still have to meet certain criteria, take certain courses, but once you've met that, then you're in the pool and then it's a little bit of luck. But again, with 120 spots, your chances go up more so than certain BSNs. We also have what's called the Connectum, which is essentially a bridge program. So students that are in an ADN can apply for the bridge program at Sonoma State, where they do the ADN basically plus 1 year. There's a couple of summers in there, and then they can get a BSN that way. So there's still a pathway to BSN by going to the JC, but that's kind of how it works. So again, all of these are options. When I work with a student, that's typically one of the first questions I'll ask you is, how quickly would you like to get to nursing school? Because then that dictates kind of what classes you're going to take. And then we may talk about your backups or your plan Bs or Cs in case your original plan doesn't play out, or because you may decide that you want to slow it down, and that's okay. So again, welcome to new folks. Feel free to ask any questions that you have along the way. I'm happy to answer those as we go. So back to SSU's program, there are 8 required courses that you must have to be eligible to apply. And our program requires a B or better in those 8 classes. Unfortunately, a B- isn't accepted. So this does make our program a little bit more competitive than other, particularly CSU programs. So the 8 that you must have a B or better, integrated chemistry course at SSU, it's Chem 105. The anatomy, physiology, and microbiology. The micro is only offered in the spring, so it's just something to think about when you're planning your schedule. Statistics is required. Your A2 or your writing course. So again, for SSU students, that's either English 101 or the combo of 100 AB. An A3 class. So most students take Philosophy 101, although you could take an FLC. If you got A3 credit, that's fine. And then any of the A1 classes or the oral communication. In addition to those 8, some of those do count as GEs, so it's not like you're taking additional courses, but you do have to have all your lower division GEs completed. Now, there aren't any GPA requirements for those. And then the other 2 classes that we strongly recommend, Intro to Psychology. And the reason for this is you don't need it to apply to the program, but you do need it to graduate to become a nurse. And so most students will fit it into their pre-nursing pathway and they have time to do that. And then this is a new change for students starting the university in the fall. The Nursing 290 nutrition course used to be recommended just because it was helpful, but it wasn't something you needed to graduate. But nutrition is actually going to become a class like psychology. We're going to need it to graduate from the nursing program. It counts as a lower division GE for area E. And so most students will pick it up, but it's going to be, you'll see a slight change on the 2-year plan to where it's going to be the one that you definitely want to pick up. Any questions about required courses? All right. So the 2-year plans are on the website. So these are not meant to be a mystery by any means, but just so that you kind of get a sense of how we group things. Now, the change is always going to be if you're entering into this plan midway through, right? You may need to be playing a little bit of catch up. You may want to think about the summer, to get a couple of courses that you need. The trickiest piece that I find is the sciences. So the GEs, when and where you take them, for the most part, it doesn't matter. But the sciences, to sort of set you up for success, we sort of break them apart. Now, you do take an intro bio and chemistry in the first semester typically, but you need those to get into anatomy, physio, and micro. But we try to divide those up based on when they're available, because micro is only in the spring, and what sort of makes sense for the order. So taking anatomy before you do physiology typically works best for students as well. So if you're already in maybe this is the spring of your first semester and you haven't taken any of these, then we definitely want to look at the summer to see where you might catch up if you're hoping to still apply next year, so that your 3rd year in college, you're hoping to be in the nursing program. Some students will push it. They'll decide, you know what, that seems too hectic, especially when I have to get certain grades. So they may decide to push it out and almost to sort of start from the beginning with the 2-year plan. Most of the time you're averaging between 13 to 16 units in order to stay on track. And this down here, you'll sort of see that nutrition is going to be kind of the recommended course. The other course that is helpful is the lifespan development course, EDEC 250. That also meets Area E. So clearly you don't need both classes for GE purposes, but they're helpful. And there are other nursing programs that either recommend or will require a lifespan development course. So sometimes taking this as an elective in this fourth semester is helpful. So a little bit about the application process. So our application window is September 1st to January 21st, the winter before you would start in the fall. So this past January, that deadline was for students that want to start in the fall of 2003. So you're applying very far in advance, almost 10 months before you would even start nursing, the nursing program. And so for students that want to start in the fall of 24, your deadline would actually be the January before that. Some other things that are important to note: if you're also planning on applying to other CSU programs, you must apply as a transfer student as well as applying to the nursing program. And most CSU transfer deadlines are November 30th. So when you're thinking about your fall semester, you're thinking about kind of the timeline for applying, you want to think about obviously SSU's deadline, but you're needing to be thinking about transfer applications. And if you're applying to a UC or a private school, you're going to need to apply to the school first, probably as a transfer in addition to the nursing deadline. For SSU, with the point at which you apply, we allow you to have one science requirement in progress for spring. So for most students, that's microbiology. You're also allowed to have one non-science, so the English, the critical thinking, etc. This is important to note. There are some nursing programs that don't allow you to have anything in progress. You have to have everything completed. And so if those end up on your list, and you definitely want to pay attention so that you're strategizing whether you get something done in the summer, so that when you start, in January, February, March, and those application deadlines for nursing, you have everything completed. But we do allow you to have one science and one non-science in progress. Again, we are points-based. So essentially the top 24 students in terms of points are what get in. But we're very transparent about how we award you points. So this is the breakdown. It's also listed on the website. We give a chunk of points for GPA. So what it is that we look at, we take your overall GPA for those 8 prerequisites. We take the average of those. Whatever that number is, we multiply it by 6.25. That gets us a number out of 25. And then we do the same thing for your overall GPA. So you get 2 sets of points, 50 out of the 120 come for your GPA. We do an essay. Those prompts are released when the application opens in September. It's a 2-page essay. We give up to 10 points. It's graded based on a rubric. The next thing we have points for is the TEAS. So the TEAS is an academic readiness exam that most nursing schools will require. It assesses 4 areas: English, writing, math, and science. And based on your score, we give you a set of points out of 15. We require at least a 78 on the TEAS exam. That only will give you 3 of the 15 points. So you definitely want to score as high as you can. And SSU will let you retake the TEAS as many times as you want. We will always take your higher score, but not every school is like that. Some will limit you or require that you wait a certain amount of time before you do a retake. So those are things you want to explore. We give 10 points for local service area. So what that means is you have to take 6 of the 8 prerequisites in the surrounding counties. So Sonoma obviously counts, but the counties right around it also count. And really the fundamental reasons is the CSUs were created to serve the community. And so the goal is to help prioritize students from this region who are trying to apply to nursing here. So students at Sonoma State typically always have these points, but even transfer students from the area typically do as well. The thing you have to keep in mind is that if you plan to retake a class, or maybe you want to pick up a class over the summer, you just got to pay attention to how many you're doing it if it's outside of the area. You can have 2, maybe back, if LA is where you're from, or San Diego, or, middle of the state, those are totally fine, but only 2 and still get the 10 points. The next big thing that we give points for is CNA, so Certified Nursing Assistant Training. This is a big part of the points that we give, and it has, there's a good philosophy on why we do it. we give you 20 points on your application for completing CNA training. Now, you can sit for the licensure and become a licensed CNA. We didn't want that to be a barrier to getting the 20 points. So as long as you complete the course and pass it, you'll get the 20 points. And then we'll give you another 5 for work experience. So you get a point per month up to 5. The reason we give so many points during the application is for 2 reasons. One, going through CNA training, I think, is a really good way to double check that you're meant to be a nurse or that you're up for nursing work. There's some glamorous and not so glamorous sides to being a nurse. And so training as a CNA really gives you insight into that. And so it's one way to confirm for you, but also for the program here that you're committed, you know what you're getting yourself into. The second piece that's really important is we don't reteach the skills you learn as a CNA, we build upon them. So the philosophy here is that our students are able to go on to more advanced nursing skills quicker and have greater comfortability working with patients when they get into clinical sites. And we find that that works best here, that our students do very well. They don't have any trouble getting a job, and they tend to do well on their NCLEX as well. So that's one of the reasons why we provide it. So we have a question in the chat. When would you recommend taking the T's, and when would be the right time to apply to nursing school? So it's a great question. Students who are on kind of the 2-year plan, there's a little bit of anatomy and physiology on the T's. And so most students aren't taking it until the fall before they apply. So the fall months leading up to January, because that's when they're taking physiology. And so you don't want to take it too early, but you don't want to take it too late either. You want to give yourself freedom to retake it if you need to, et cetera. So I generally recommend that summer is when you want to come up with your plan. Maybe you start studying October and November, maybe you take it somewhere in there, but give yourself room to retake it if you need to. Now, if you're not on sort of a 2-year plan for pre-nursing, it gives you a little bit more flexibility. But you do want to think about a timing that will allow you to have some anatomy and physiology completed before you jump into it. And then the right time to apply to nursing, again, if whatever fall you want to start, you're going to be applying 6 to 8 months prior to that. But the question to ask yourself beforehand is, again, how quickly do you want to get to nursing? Do you want to try to get there as soon as possible, or do you want to try to finish a degree first and then look? And again, we can set up plans for both so that you can decide along the way. But that's a great question. We do give 5 points for veterans and 5 points for students that are admitted as pre-nursing. So it's 120. I often get asked, students often ask, well, what is the cutoff, or what is the typical amount of points students need to get in? It's not really published because it can vary so much. And because the CNA that was added, I think maybe 3 years ago now. And so you can't compare it too much to years previous because the number of points was different. Generally, I say the admitting class has somewhere in the 90s, but that's just kind of a rough sense to kind of show you how competitive it is. Any questions about the application points? Okay. So I mentioned this already, but here's the list of actual counties. So Sonoma, Marin, Solano, Mendocino, and Napa. CNA programs, there's a list of all of the ones that are approved in the state of California on our website, because it doesn't matter where you take it. There are ones where you can go weekends only. There are full-time ones, and there are summer programs. A lot of students will do it in the summer. I think trying to tackle it while you're in school, even if you did it on the weekends, can be a little bit much, especially when you want to get the good grades that you need to be competitive. So those are things to keep in mind, but lots of different types of programs exist. And then for us, applications are due January, but the decisions are sent out in early March. So we're a couple weeks out maybe from the students that applied this year of knowing if they got in or not. So how to strengthen your application. So these are my tips. You definitely want to get good grades. That's really a fundamental. Minimum to get into our program, you have to have a 3.0 to be eligible. But to be honest, to be competitive with BSNs, you really have to have closer to a 3.5. Now, we fortunately have a little bit of variety with the points. So if you had a 3-4, but you had a really strong T's and maybe you got some CNA experience, you definitely could still be competitive. But, aiming for at least a 3-5 for BSN programs is important. I always give this tip to students: only move as quickly as you can do well. So again, sometimes when I meet with students, particularly if they haven't started out in pre-nursing, there's a sense of already feeling behind. And so sometimes students want to overcompensate by trying to get there as quickly as possible. As much as you can, try to resist that urge, because you really want to set yourself up to get as good a grades as you possibly can. You got to have that B or better in the 8 courses, but getting a really strong GPA is so important, because if you have to go back and retake, then you're going to delay anyway. So really try to strike a balance between how quickly you're moving and what allows you to do well. Study hard for the T's. So, you want to try to shoot for getting the best T score you can right out from the gate, because it's time and it's money that you have to invest. So at the very least, we recommend that you get a study guide. You can buy those on Amazon for, $30, $40, but you may want to consider practice exams. The ATI website, which hosts the T's, you can pay for practice exams, but the benefit of that, it gives you feedback on how well you did, so that you can sort of, tailor and narrow your studying. So maybe you take it and you realize, oh, my math is great, but I got to work on this writing piece, or that science, I really don't have all of the physiology dialed in, so I need to study up on that before I take it for real. So consider all of those things. You can definitely spend no money, you can spend a lot of money. So find the sweet spot for you, but definitely put some time and energy into studying. Get your CNA early so that you can get some experience. So that's why the summer is helpful, because if you complete it in the summer, if you think about that's maybe August or September, you still have the ability to get the maximum 5 months of experience before the application deadline in January. My also advice, so when you're thinking about GE classes, is to take classes that help you understand how to serve diverse populations, especially if you want to be a nurse in California. Some of these are going to play into the GEs that you have to do anyway, but when you have a choice, try to pick things that will aid you in that endeavor. I do advise that you research multiple nursing programs. Even if SSU is your number one, or you really want to get in, still check out other programs so that you have a sense of it. And my general advice is that you want to try to aim to apply to maybe 3 to 4. Sometimes it's 2 to 3, sometimes it's 4 to 5. You got to factor in it. Again, it's time, it's money, because you have to pay application fees. You've got to request transcripts. You've got to send T-scores, all of these things. So you don't want to overdo it. Sometimes I have students that have like 6 or 8 on their list, and I was like, it can start to feel like a part-time job just getting your applications lined up. But when I also have students who put all their eggs in the SSU basket, sometimes my heart aches a little bit, just because it is so competitive and the cycle is only once a year. So if you try just for one school and you don't get in, then you're looking at least a year before you can attempt it. So find the sweet spot for you. I'm happy to talk more with students about that. Again, take recommended classes for the schools that you're looking at. So you might have a school on your list, but you want to really check to see if there are recommended courses beyond the required, how many times they'll let you take the T's. If they allow you to have classes in progress, you really have to dig deep, even though the main classes are probably the same, but you may be able to get points if you take nutrition, or points if you take lifespan, or maybe you need another sociology or anthropology class for that school. So knowing those ahead of time are helpful. Know that multiple pathways exist, again, but try to choose the one that's best for you, and always seek advising. So whenever you're at a point where you need to change your pathway, you've got questions, you're always welcome to reach out to me. Okay. This is one of the things I always share with nursing students, is that if it's meant to be, it will be. And so what I pass on to you is that you are meant to be a nurse. My belief is that you will be one. Now, your pathway may look different. Your timeline might look different, but if it's truly meant for you, there is a way to get there. So this is where I have time for questions, but let me go through some of my FAQs while you're formulating your questions in your mind. Feel free to drop them in the chat. But here are some things that I often get asked. I'll just sort of address those from the beginning. So sometimes I have students that get a B- or a C+ or whatever, but a B- I think is maybe a little bit more of a heartbreak, because it starts with the B. So the question is, does it still count? Should I retake courses to improve it? And unfortunately at SSU, the B- does not count. And so if you want to keep SSU on your list of schools, you would have to retake a class. Now, you don't have to retake it here. Many students will try to get it in the summer, retake it at community college just because of scheduling. But sometimes, depending on where you are in the process, you may decide, like, I've already got these other 3 schools, my GPA is still competitive, I'm feeling good about everything else. Taking time to retake a class in that situation may not be the best. So it's a little individualized, but it is something to be aware of. You need at least a B or better. So someone already asked this question, when should I take the T's? So again, a lot of students doing it in the fall before they're applying, but you want to kind of time it with anatomy and physio, and when you've got the ability to put in some studying. So I often get asked, or people will just email me saying, I'd like to switch I want to change my major to pre-nursing. And unfortunately, you can't switch into pre-nursing. We only admit students when they start at SSU as first-time students. So even transfers, sometimes people want to transfer to SSU, work on pre-nursing, and then apply to the pre-licensure program. Transfers can come to SSU, they can't just be in the pre-nursing program, but students can work towards nursing from another major. So some students will stay in the major they've declared. Some will switch to undeclared because it feels like a better placeholder. Because if honestly you're in a major that you have no intention of completing, sometimes it's best to sort of switch out and just hang out in undeclared and then get advising from me. What if I didn't take this class in the fall? Do I have to wait another year to apply to the nursing program? So not necessarily. I pride myself on trying to be strategic. So again, depending on how quickly you want to work, we can look at summer and sort of how the sciences fit and in what order to try to get you on track in the timeline that you want. But again, I still always provide that caveat of only go the super fast route if you feel like you can get the grades that you need to be competitive. It's really probably better to take a little longer, take an extra year, wait 1 application cycle so that you can really get the grades from the beginning and set yourself up for success. The other thing I want to kind of comment on in regards to moving quickly, I often see this dynamic even with students that are already in the pre-nursing program, but there's such a desire to get to nursing. And pre-nursing, has some stress because you know that things are competitive, you got to get good grades, you're thinking about the T's. But once you get into nursing, if it's at SSU or someplace else, it's no longer really a traditional college experience at that point. So one of the things I often recommend is while you're working on pre-nursing stuff, like don't forget to be a college student. Like don't forget to get involved in a club or 2 or an attend event or go to the rec or join an intramural team, right? Because once you get into nursing between classes and clinicals, you do not have time to do those kinds of things, or it will be very, very hard. And then that's, then college is done. And so sometimes when students are like heartbroken that they can't move as quickly, sometimes the flip side is that you then have some time to not only get good grades, which you really need for nursing, which is your long-time goal, but also maybe you have time to get involved and enjoy and experience college in ways that you wouldn't have the ability to do once you get in. How many hours do you need to work as a CNA in order to count 1 month? So students often ask this, oh, if I need 5 months to get 5 points, do I have to work a certain amount of hours? Do I have to work part-time? What does that look like? The answer is there's not a set amount. They're less concerned with the amount of time you spent doing it and more the longevity. I just want you to have a chance to have practice using those skills. So you could do a shift, 1 shift a month, and you'd be able to count that month. Maybe you decide that you're going to pull 1 or 2 shifts every weekend, or maybe you need part-time work and this is it, but you're only going to be able to work 10 hours a week. Doesn't really matter that the amount, just so long as that you're employed and that you've worked at least once that month, and we will count it. Then I also often get this question. So is there a particular major that will increase my chances of getting into nursing school? So for those of you that may be undeclared and know you can't get into pre-nursing, sometimes people ask, well, what major should I declare? And the answer is you can stay in undeclared, especially if you want to get to nursing as soon as possible. But the other answer is it doesn't really matter. You can major in anything that you want. If ultimately your goal is to finish a degree first and then go to nursing schools are not going to care at all what you majored in. Like not at all. They're going to look at the classes that you took that they're requiring. They're going to get your GPA, your T's, etc. So it has no bearing really. So my advice is to pick something that you enjoy. And that might actually be something that's not in the sciences. The ironic thing is that the requirements you need for nursing school actually don't align super great with a lot of the other science majors, particularly biology, chemistry, biochem. The bio and the chems that you need for nursing are different than you need for those majors. And so they just don't overlap enough. And it's not to say that you can't do it. I have some students that do, but it's not the obvious option or alternative if you can't get into nursing right away. Some students will talk about kinesiology, and there's a little bit of overlap because of anatomy and physio, but kinesiology is a very different science, right? It's the science of movement, whereas nursing is the science of caring for people. And so if kinesiology sounds interesting, great, but I think for a long time there was this rumor that, oh, if you can't get into nursing, just get into kinesiology. And I wouldn't give that advice universally. But I have students that will look at psychology or human development or women and gender studies, or they'll major in Spanish, especially if they come in with AP credits. Some will look at kinesiology, but a lot of the social sciences and humanities have a lot of flexibility. And so you're able to complete those majors in addition to your pre-nursing classes and be eligible to apply. So don't get too caught up on which one is best. Think about what you'd want to study and what you could do well in, and then maybe use that as a starting point. So those are all my FAQs. So what other questions can I help you with? Feel free to put them in the chat. Also feel free to unmute yourself and ask live if you'd like. I think there's 7 of you left. So it's sort of a 7-on-1 advising session. But again, I've got time. So I want to hear what questions or specific things you want to know about.
Hi, Jamie. I had a question.
Yeah.
So I put in my application, and I'm looking at backup plans right now. So
Okay.
I was interested in the MSN program, and you had mentioned earlier that you have to catch up on clinical experience. Is that like a nursing clinical experience or just like hands-on experience?
Yeah, that's a great question. The reason I sort of say that is I've had conversations with the chair of the nursing department here, Dr. Ana Valdez, related to master's programs about a couple of other things. But one of the things she shares is, nurse practitioners, they work so independently, but in order to be able to do that, they have to have logged like hundreds and hundreds of hours of clinical work, like bedside patient experience. And so in a 3-year time frame, it's harder to get all the hours that you need to really be able to work as a nurse practitioner. Again, I don't know all the details, but she was just saying that sometimes that can be a challenging piece. So sometimes what I've heard, we have a program here on campus that prepares students to apply to other health professional schools. And Dr. Lin in the biology department leads that. And he brought in a nurse to speak in one of his classes a couple of years ago. And this particular person had a degree in something else and then applied to, I believe it was UCSF's direct entry master's. So after 2 years, then you can sit for the licensure to be a registered nurse. And then that 3rd year is the master's program. But she actually took a year in between and worked as a nurse and then came back. So in total, she took 4 years so that she could get caught up and get more patient experience and comfortability. So I share that just because I think it's something that students in those programs have to think through. I just don't know all of the details to be able to provide it, just because nurse practitioners do need to log a lot of patient hours.
All right, thank you.
Mm-hmm. What other questions do you all have? So someone replied in the chat, what are the costs to apply? Do I know of any fee waivers? So fortunately, the nursing program is the same price as any other undergrad degree. So if you just search SSU tuition, you can see the costs. I'm sure we're comparable to most CSU programs. I think tuition roughly is about $4,000 a semester. Now you will have fees that are higher for nursing students. You've got to purchase uniforms and equipment. Some of the nursing books are a little bit more expensive, so you definitely need to plan for that. I'm not aware of any fee waivers. I know at the community college level, there's often fee waivers available. The CSUs work a little differently. Tuition and fees are just sort of a package deal, but I definitely encourage students to apply for financial aid. I will tell you that nurses in California, particularly in this area, like they do not have a trouble getting a job, and they do not have trouble getting a job at a very good salary. When you look at entry-level salaries for students with a bachelor's degree, nurses almost win every time, sometimes even more than engineers. So if you have to take out some loans, this is just sort of my personal advice. Obviously, you want to think through and talk with financial aid counselors about this, but just that comparison of the potential wage earning you can do as a nurse, if you need to get some financial aid, including loans, it's not a bad investment to invest in yourself when it comes to a nursing degree. So just something to think about. Any other questions I can help with?
I had another quick question. So when I'm looking for other programs, particularly like out of state as backup programs, a lot of the classes don't overlap, and it's making it very hard to try to find something that's maybe a little less competitive outside of California. So I just wanted to see if you had any advice or recommendations about that and where I should be looking.
I don't have any like list of programs to consider. I do think that is sometimes the challenge when you're looking at different states. The requirements can be different. Now, if they're looking for anatomy and physio or statistics, even if it feels like it's slightly different, oftentimes they're going to accept the ones that you have. But yeah, if they have a different list of requirements that we don't require, I sometimes even see that with UC programs. I've had a student before, he was looking at maybe UC Irvine and needed like a pathophysiology class, and we just don't teach that at the undergrad level. One resource you do have access to is that you can take classes through CSU fully online, and I can explain that a little more. But the short of it is that as a CSU student, you can take online classes that are offered through other CSU campuses. So what's nice about that is that if SSU doesn't offer it, it's possible that another CSU does, and so that you can get it through the CSU fully online process. Doesn't cost you anything, it counts towards your units here, so it's fairly seamless. So that may be something, if you've got time and you're planning for an out-of-state program that needs something additional that we don't require and maybe don't even teach, you can look at that. You could certainly do that with community colleges in the summer too, but sort of depends on if it's an upper division or a lower division class, or kind of what the requirements are. But I think there's some resource that sort of depends again on your timeline. If you're trying to get there quickly and like applications are happening and you don't have it, that could be challenging. But if you're thinking about in the future, if we know what we're looking at, I can definitely sit down with students so we can figure out how to get those equivalents.
Thank you.
Mm-hmm. Anything else? Well, thanks everyone for coming. Hopefully, if I asked you those words again about how you're feeling about nursing, hopefully you're feeling a little relief, maybe a little bit more excitement or curiosity. Maybe we've relieved some of the overwhelmment. It definitely can be a stressful process because it's competitive. But like I said before, if you're meant to be a nurse, my belief is that you will find the pathway and the nursing program that will work best for you. So I'm here. My email's on the slide, so feel free to email me. You're always welcome to call the advising center and schedule an appointment. I meet with students all the time. And I will say, now is not a bad time to schedule with me, because once we get into April after spring break, it will start to get busy with advising appointments as we get ready for fall registration. So the next couple months are good, or the next few weeks are good if you'd like to connect. So thanks so much. Have a wonderful day.